Yes, we are.
Okay, thank you. Go for it.
Can I go?
Yes.
Good morning, everybody. Like she said, my name's David Atkins. I didn't quite grow up in Hill City. I was actually born in Quinter, and then I went to school in Moreland. But Moreland no longer has a high school, so I guess I call Hill City my second home. Pay attention today, please. There are lots of opportunities in healthcare that you don't want to miss. We have an ever-changing field. It's challenging. It's rewarding. There's jobs everywhere in healthcare, and it's some of the best-paying jobs. Easy to find. Nursing school is probably one of the broadest jobs you can get, and there's jobs everywhere. I'll go over being a physician. It takes a little bit longer, but the rewards are, in my opinion, much higher. I absolutely love my job. It did take a while to get where I'm at. This is my first job that I've ever really had, and I'm 33 years old, so it does take a while, but it's very rewarding. I'm going to go over, actually, if you go to the next slide, I'll go over my outline. You can see, I'll talk about what I do. Scoot back into frame. I'll talk about what I do on a daily basis, what my job kind of covers. I'll talk about how to be a physician, how long it takes, with the different types of school, with medical school and residency and your undergraduate work. And of course, the different types of physicians. Believe it or not, there's 120 different types of physicians. I'm just one of them. And then salaries, we will talk about salaries. Physicians get paid well. There's no beating around the bush, but it's a long journey. Why I think it's the best job in the world. We'll talk a little bit about some of my favorite parts of the job. A typical day in my job, and then we'll talk about similar jobs. I'll actually talk about some of the other jobs we're going to talk about later today too. And then we'll open it up for any questions that you guys have. Okay, next one. I am a family physician. I'm board certified in family medicine, which means I did my undergraduate work, I did my medical school work, and then I did a 3-year specialty training in family medicine. In the past, doctors would finish their medical school and become a general practitioner or a GP. And there's actually several GPs out there practicing right now. They didn't do the specialty training. In 1969, family medicine actually became its own specialty, which is not really relevant to you until you actually get there and realize the advanced training that we actually do have. I provide healthcare for everybody, whatever walks in the door. I don't do heart surgery. I don't do brain surgery. I don't replace knees. I don't replace grandma's hips. I do basic health care for everybody that walks in the door. A big part of my job is recognizing when I'm not comfortable taking care of a patient and I ship them somewhere else. But I am trained to take care of about anything that walks in the door initially. I work in the ER. I provide emergency medical services, and I work in the clinic. I work in the hospital. I work in the nursing home. So I have a very broad job. It doesn't matter. I take care of my youngest patient right now, I think is about 3 weeks old. My oldest patient is 102. So it doesn't really matter what age you are. Of course, it doesn't matter what gender you are. I take care of men and women. Some doctors actually just take care of men. Some doctors just take care of women. You can't specialize in that. It doesn't matter what race. It doesn't matter what disease you have. It doesn't matter where you are. A family physician can take care of you. Previously known as the GP, but in 1969 we became the 20th specialty. Some family medicine doctors will actually do obstetrics. They'll deliver babies. Newborn care, geriatrics, palliative care, that's when grandma's just too sick and she doesn't want to go on anymore, doesn't want aggressive treatments, doesn't want to be transferred to KU, just wants to pass away slowly. That's actually a big part of our job, is helping people die with dignity. Emergency medicine, nursing home, inpatient, minor surgeries. Essentially, I feel like I'm the jack of all trades but master of none. There's not any one area that I focus on. My entire training has been all over the place. We listen and we help. That's the biggest job of a primary care physician or a family physician, is to listen to their patients. Sometimes, I'll be the first to admit it, some of my patients just want to talk. And they just like to talk. They need that. And that's actually better medicine than giving them a pill. If you give them somebody to talk to, sometimes that's even more helpful. And you'll learn about that. Nikki may even talk about it in nursing. One of the things that nurses do is talk. They listen to patients and they help them out. It's not just pills. It's not just needles. We actually heal emotionally. You can work in rural areas. You can work in big cities. You can work on Indian reservations. You can work overseas. If you want to get involved in overseas missions, specializing in family medicine is going to be one of the best fields to get into, because if you're in the middle of nowhere, you need to be trained in handling the young kids, the middle-aged kids, the older kids, and the old people, men and women. If you go over there as an orthopedic surgeon, you're going to be able to take care of knees and hips and ankles, but you're not going to be able to take care of diabetes or high blood pressure. So if you want to get in the mission field, family practice is a great specialty. You can even work in the hospital. You can work just in the ER. You can work in the government and do policy. If you want to work with Medicare, you can just be a policy guy. You can work in the lab and do research, or if you want to be a business guy, you can wear a suit every day to work and handle insurance policy. You can handle research. You can handle grants. You can tell insurance companies what to do. You really can do about anything in the primary care world. Next one. The journey. This is a typical journey for a medical student to become a physician, and you cannot look at it as one step. It's actually several different steps. If you look at the journey and say, who in the world wants to spend 11 years in school, nobody would want to do it. But you got to look at it. It's just one step at a time. You go to college, you have your fun in college. Undergraduate degree is typically 4 years. It doesn't matter what degree you get. You can get I have a life science degree. You can get a physiology degree. You can get a degree in music. You can get an engineering degree. You can do whatever you want to do, just as long as you take the required classes to get into medical school. Medical school is 4 years. You can be an MD, that's what I am, that's a medical degree. A DO is a doctor of osteopathic medicine, same thing. You can be an MBBS, which is if you go to Europe or the Middle East and get a medical degree, you can come back and practice, but you're not going to have an MD or a DO, you're going to have an MBBS. And there's even some other medical degrees that are the equivalent. But you have to do some sort of medical school, and typically they're 4 years long, to get your degree. And then you officially become a doctor, but you don't have a license to practice, so you're a doctor in training. The next step is your residency, and the first year of residency is called your intern year. So specialty training. First year is your intern year, required to practice, and now if you want to be a GP, you still have to do at least 1 year of residency. And then 3 years if you want to be a hospitalist, which they just work in the hospital, take care of people in the hospital. If you want to do emergency medicine, family medicine, and pediatrics, that's all 3 years. If you want to be an obstetrician and deliver babies, you have to go to residency for 4 years. Psychiatry, pathology, all 4 years. If you want to be a surgeon, they actually have to do 5 years of training on top of their medical school. If you want to be an ear, nose, and throat surgeon or radiologist, that still takes 5 years. If you want to be a brain surgeon or a neurosurgeon, that typically takes 7 years after medical school. So if you want to be a neurosurgeon or you see a brain surgeon, they've got 4 years of undergrad, 4 years of medical school, and then another 7 years. Can you guys do math yet? That's 15 years of training. 15 years of training before they get their first real job. Sounds exciting, doesn't it? And then if you want to do fellowships on top of that, if you do your 3 years in internal medicine as a hospitalist, and then you do another 3 years as a cardiologist, then you do another 2 years in invasive cardiologist. I mean, some of these guys are graduating when they're 35, 38 years old, and if they did anything else in their path or did not go the traditional straight through, they may be 35, 40 years old when they graduate. And non-traditional students go to medical school too. I actually graduated with a lady. She was 53 years old when she graduated medical school. And then she did her residency, and she was 56 before she started her first job as a doctor. So it's never too late. If you want to do something else for a while and go back to medical school, feel free. Back up here, there's different degrees. The medical degrees are the MD, DO, MBBS, or the equivalent. DC, that's a doctor of chiropractic. That's not a physician. They're a doctorate degree, but they're not the physician. They don't provide health care in the same way that we do. OD, that's the optometrist. DD, a doctor of dentist. DVM, that's a doctor of veterinary medicine. You'll hear from them today. JD, that's a lawyer. Lawyers actually have doctorate degrees. Did you know that? It's a Juris Doctorate. So you can call them doctor if you want to. And then the PhD, those are the researchers that typically wear the white coats that look at microscopes most of the time. Next slide. For me, I actually had an opportunity at Moreland to take a lot of classes for college before I even graduated. We had interactive, or ITV is what we called interactive television. I had a room. Our TVs weren't near as big. We actually had 4 of those big, wide TVs. And I took physics, I took college algebra, I took anatomy and physiology, I took English classes. I had 29 hours of college credit by the time I finished high school. Now my GPA wasn't very good, but I had those hours, and that allowed me to skip 1 year of undergrad. I finished it in 3 years at K-State, thinking that I wanted to be a doctor, and I actually changed my mind. I decided that I didn't want to go to school that long. It was too intimidating. I did not want to go to school for 11 years. I decided I was going to be a physician assistant, which is an extra 2 years. And then I decided I was going to be a nurse anesthetist, and I actually enrolled in nursing school. I spent 2 years wandering. I did my EMT school, some Army school, and then I did nursing school. I made it halfway through the first class and decided it wasn't for me. It wasn't for me. I didn't click with me. It's not what I wanted to do. It's a great job, and I really respect the nurses, but it wasn't for me, so I changed my mind. And that's another key point, is don't ever be scared to change your mind. If you get into a field and you're not happy, stop, find out what you really want to do, and do it. Don't get stuck in a hole, and don't get stuck in a career you don't want to be. Make sure you change your mind. If you want to change your mind and pursue what you want. I could have ended up a PA or a CRNA or a nurse, and it's not what I wanted to do. It was definitely worth it. Now I'm on the end of the schooling. I definitely can look back and say I'm grateful that I didn't get stuck in a career that I didn't want to do. And then I did 4 years of medical school at KU from 2006 to 2010. I did 3 years of residency in family medicine at KU. I spent about 13 years. I graduated from residency when I was 31. Typically, it's at least 11 years of training. And just because you're going to school, it doesn't mean you can't have a family. I got married after my undergraduate work. I had 2 children during residency. You can go ahead and live your life. It's just, you consider it a job. You get paid a little bit of money during med school and residency. It's just a job. So it is a long time, but take it one step at a time. Next one. Undergraduate, when you go to undergrad, you get to choose how hard you get to work, or you want to work. You get to choose what degree you want. You can do anything from engineering, sociology, biology. If you really want to work, be an engineer, or do biochemistry or chemistry. If you want to have more fun, you can actually get a degree in dance. We actually had somebody in medical school that got a degree in dance. The top of our class, the smartest person in our class, actually had an undergraduate degree in French horn. It doesn't matter which degree you have. It really doesn't. You need to have your biology, your science, your chemistry background, but you can have a degree in about anything and get there. We actually had 2 nurses that finished up their nursing school and started medical school. We had a physician assistant that didn't like what they were doing and wanted to go to medical school. A lot of engineers. Engineers is probably the one that I wasn't expecting to have a lot of classmates in engineering, but we did. Typically, they are the biology, the chemistry, the life science. I mean, about half the degrees are for medical school applicants are going to be those. So it's variable. If you want to work 20 hours a week or 40 hours a week, or if you want to work 80 hours a week, you can get your undergrad degree in a bunch of different things. Next slide. Medical school is not easy. It is hard, but you get used to it. Year 1, you're in a classroom about every day. You are studying, you're taking tests, nothing but books. You get to see maybe one patient every few months, but you're not in the hospital, you're not in the clinics, you're just studying. And that's the first 2 years. Your second year is the same, except you just kind of get used to it. And I would typically spend about 10 to 15 hours studying the first, we'd have 4-week blocks. I'd spend about 10 or 15 hours studying the first week per week. I'd spend about 30 to 40 a week the second and third week. The last week before a test, which is cramming, which you shouldn't do, I would spend 12 to 13 hours a day studying. I would go to the library at 6 o'clock in the morning, and I'd study till 6 or 7 o'clock at night. And I do that 7 days in a row. And you don't think you can do that, but if it's what you want to do, you find a way. That's the big, you can just find a way. If it's really what you want to do, you find a way. Don't think it's impossible. Third year, you actually get to the hospital, you get to the clinics, you start wearing your little white coat, and you have a stethoscope, and you walk around, you see patients. You see the patient, and the resident will see the patient, and then the actual doctor will see the patient, but you're actually practicing medicine at that time. 4th year is the same, just a little bit easier. 4th year, you start worrying about interviews, where you're going to go for residency. Next slide. Residency, this is probably the hardest part. Believe it or not, after you get through the first 8 years of training, this is when the real work starts. Your intern year, which you've seen it on TV, on Grey's Anatomy and ER, they always talk about the intern year. It's hard. You spend about 70 to 80 hours a week in clinic and in the hospital, and you rotate through all the different areas. If you're going to do a family medicine residency, you rotate through everywhere. This is when you start specializing. If you're going to be a surgeon, all you rotate through is your surgical specialties. But it's long. The hours are very long. Your second year, if you do family medicine, my second year was a lot easier. I was probably working about 60 hours a week my second year. Third year, I probably worked 40 to 50 hours a week. But it does get easier as you get through it. And training hours depend on residency. If you're going to do surgery, you're going to spend 80 to 90 hours a week in the hospital working for 5 years. And you basically don't see the sun. It's very hard to have a family if you're going to be a surgeon. They really sacrifice a lot to get where they are. Family medicine, we have a lot. It's a lot easier to do a family medicine residency. If you're going to do psychiatry, you do your 4 years, but it's probably 40, 50 hours a week. They don't work near as many hours. Next slide. Different flavors of doctors. I said I'm a family medicine doctor. You can work just in the ER. Pediatricians, we work with little people, and you can specialize within pediatrics. If you want to be a pediatric cardiologist and just work on kids' hearts, you can do that. If you want to be an endocrinologist and just work with diabetes in kids, you can do that. Pediatric sports medicine is a specialty. You can do about anything within pediatrics. Internal medicine, those are the hospitalists. A hospitalist can work in the hospital and take care of people, and then they can also specialize, and that's where you get your cardiologist, your endocrinology, which is diabetes, nephrology, your kidneys, GI doctors, and cancer doctors. ENT is ear, nose, and throat. Surgery of the face. Dermatology, if you want to deal with rashes. If you want to treat high school kids with acne and deal with rashes all day, be a dermatologist. I'm not a fan of dermatology. Anesthesiologists, the sleep doctors. If you want to stick a needle in somebody and put them to sleep, you could get a job in just doing that. If somebody's getting ready for surgery, it's your job to put a needle in them and make them go to sleep. How rewarding would that be? Pulmonologists, the lung doctors, they typically work in the ICU. Ophthalmologists are the eye doctors. They're not optometrists. They don't typically do eyeglasses. They do cataract surgery. They do all the other glaucoma, all the other eye diseases, but they don't typically make the eyeglasses. Next slide. Surgeons, many types of surgeons, neurosurgeons, orthopedic surgeons, psychiatrists, OB-GYN doctors, they're the storks. They deliver babies and do any other women's health issues. Radiologists, they're typically the computer geeks. You can actually get paid if you go through 4 years of medical school and 4 years of residency, and then you sit in front of a computer, and typically they have screens that are about this big, and they look at x-rays, they look at CTs and MRIs all day, or mammograms, and that's all they do. A lot of them can work from home in their pajamas. They roll out of bed in the morning and they look at their computer all day, and that's their job. So if you want to do that, you can even do that. Pathologists, autopsy, specimens, they're the ones sitting behind a microscope. They're doctors too. They get a medical degree or a DO, and then they do a residency and they look at slides all day. Neurologists, they deal with the strokes, neuromuscular disease, Parkinson's, seizures. Next one. A couple other tidbits. There's 120 different specialties. Only 20 existed in 1969. That's not too long. 40 years ago, we only had 20 different types of doctors. Before that, we had two types of doctors. We had surgeons and not surgeons. And then they keep specializing and keep specializing. And at this point, we have 120 different specialties. So the trend in medicine is actually getting more broad. We have more specialties. We can do more. We have more procedures, more medications. And family medicine is one of the few jobs where we actually have a little bit of everything. You don't specialize because that's what the specialists are there for. And you can even specialize within your specialty. Different types of family medicine. Some doctors deliver babies, some do the ER, nursing home, etc. Next one. How much do I make? That's an important question. First, we'll start with the other specialties. And we don't do it for the money. You're not going to do it for the money. First of all, most of us graduate. I'll go into that. Most of us graduate with a lot of debt, and it's kind of hard to pay for it. So you have to pay us money because nobody's going to go through the amount of schooling that we have and go into the debt we have if you can't pay it off. An orthopedic surgeon, they're some of the highest paid physicians. They'll make $413,000 a year. It's a lot of money. Cardiologists will make $350,000. Dermatologists over $300,000. Surgeons $300,000. ER doctors $270,000. I'm actually in the lowest bracket in family medicine doctors. Our average salary is $175,000. That's the average across the board. Typically, if you work in a small town and do ER like we do, we would make more money than that typically. If you work in a big city and you're just working in a clinic, you're going to make about that or a little bit less. So it is a good paying job. As a resident, when you're actually in medical school, you're still paying them to go to school, but in residency, they actually pay you about $50,000 a year, which is a lot of money. But you have an undergrad degree and a medical degree, and you're making $50,000 a year working 80 hours a week, which is about $7 or $8 an hour. And you think you have 2 degrees and you're making $7 or $8 an hour. It's not a whole lot, but it pays the bills. And you're not going into debt at that point. You're actually starting to work your way out of debt. Next one. It also depends on if you work in a hospital, a clinic, rural, urban, underserved. Some people get paid if they work more. If they work more hours, they get paid more. If you want to make less, you don't work as much. It's pretty easy. It's not everybody makes this amount. If you work hard, you make more. Next one. Here are some average information about debt. Average debt for 2014 graduates. If you go to a public school, you have an average of $167,000 in debt. A private school is $190,000 in debt. I have about $35,000 in undergrad loans. Medical school is about $208,000. With interest, it's over $300,000 in debt right now. That's all sad, isn't it?
Mm-hmm.
But there's programs to help you pay for that, and you will get it paid off. You have to look at the long term if this is what you want to do. Also, consider you're at least 29 years old when you start your first job. I'm trying to push you into medicine. I'm not trying to push you away. But these are some of the hard facts you got to deal with. And if it's a surprise when you get there, it's going to be a lot harder to deal with. But to expect it, it's going to be hard. It's going to be long. You're going to sacrifice a lot. And you're going to go into a lot of debt to get there. But it's worth it. Next slide. Why do I do it? Find something you love doing, and then find some way to get paid for it. If you love taking care of people, then the medical field is right for you. If you want to spend more time with patients and talk to patients and help them out, then maybe a nurse or a physical therapist. If you want to go to school for a long time and you want to be the one directing the care, if you want to be the one responsible for the care, if you want to be the one writing the orders and not asking somebody else what to do, if you want to be the one making that decision, and knowing, for me, it was more I wanted to know as much as I could about my patient. I didn't want to not go to school. I wanted to go to school and learn everything I could about a patient so I could make that decision, so I could be comfortable making that decision when it really mattered. It's challenging. It's very challenging. It's very stressful when you're responsible for everything that walks in the ER. A couple weeks ago, a lady came in full labor, and we had to deliver a baby. Nurses weren't set up to deliver babies. We hadn't delivered a baby, and I guess we delivered one baby 2 years ago. But it's stressful when grandpa comes in having a heart attack, or grandma comes in bleeding. It can be very, very stressful at times, but it's also very rewarding. So you got to pick your battles there. I think it's what I was meant to do. I dabbled around in business. I dabbled around in nursing school, PA school, EMS, and I cannot explain it, but I would not be satisfied doing anything else. This is what I was meant to do. Second choice, if I didn't do this, I would probably be a teacher. I love teaching. I could definitely consider being a physical therapist. I could even do engineering, or I have 2 great kids. I could stay at home with them if I really put my mind to it. So there's a lot of other careers. Some days are bad, but the good days make up for it. When somebody gets sick and there's nothing you can do about it, those are bad days. When you have a sick person and you put them in the hospital for a few days and you make them better and they walk out, those are good days. I recently put somebody in the nursing home about 3 months ago. I thought she'd never walk again. Just yesterday I went to her room and she got up on her walker, walked all the way across the room and came back. I almost cried. And to see people progress, and you really can make a difference in people's lives. And it wasn't me. It was the nursing staff. It was the therapist working with her. It was the aides. It was everybody from the top down, the entire spectrum of healthcare team that got this lady walking again. And she's going to go home. She spent 3 months in the nursing home. She's going to go home, and that's fantastic to give people their independence back. So it's very rewarding. Next one. Something interesting, I already said I delivered a baby. It's not really part of my job here in Hill City, but sometimes we have to do it. A couple months ago, I removed a toothpick from somebody's ear. Never clean your ear with a toothpick. I don't know where this gentleman missed that in school, but I'm going to tell you now, don't ever clean your ear with a toothpick. Don't ever clean your ear with a key or anything else. Q-tips are okay if you clean the outside of your ear. Don't ever stick anything in your ear. It gets stuck. I've even seen the end of a Q-tip break off in somebody's ear and turn into an abscess. So clean your ears, the outside of your ears. Don't stick toothpicks in your ear. Removing toenails. That's actually kind of fun. If you have an ingrown toenail, come see me. I'd be more than happy to take your toenail off. Suturing. I learned how to suture before I learned how to sew, and it's basically the same thing. So if I have a rip in my jeans or my scrubs, I can sew it back together now thanks to medical school. Talking to grandma about pooping. Yes, grandmas poop. And yes, they like talking about pooping. So that's actually, I did not realize how often I would talk to grandmas about pooping, but they do talk all the time about pooping. Whatever walks in the door, it doesn't matter. The joy of being a family physician is if it happens, in this town, it's most likely either going to come to the ER or it's going to come to the clinic. We've had some people walk in the clinic having a heart attack. You just never know what's going to walk in the door, and that's kind of fun. Next one. My typical day here in Hill City, if I'm on call, I may come to the ER in the middle of the morning. Sometimes it's 2 o'clock in the morning, sometimes it's 3 o'clock, sometimes I don't get called at all. Last night I was on call. I went in at about 6 o'clock then p.m., took care of somebody, and then I didn't get called the rest of the night. So this morning I actually slept in. I think everybody needs to wake up in the morning and exercise. I don't care how busy you are, you need to find time for it because it makes everything else in your life better. And I know that the last 6 months when I haven't been working out, I didn't feel as good. So that's another plug. Just exercise. Find some way to exercise, especially after high school. You're involved in sports right now and you're exercising. When you get done with high school, you're not doing your sports. Make sure you find some avenue to stay fit. Typically, I get to the hospital at 8 o'clock in the morning, and I'll see my hospital patients. If there's nursing home patients to see, I'll go to the nursing home. If there's procedures, if there's toenails or skin cancers to take out, I'll do that from 8 to 9. I go to clinic at 9. I see whatever walks in the door. It can be a newborn visit for a 3-day-old patient, or it can be grandma updating her diabetes or talking about pooping. It doesn't matter. I don't know what's on my schedule from day to day. I go home at lunch. A short drive is important. I live about 2 minutes away from the hospital, so if I have a 60-minute lunch break, I spend 58 minutes with my family, and that's important to me. I go back to clinic at 1:30. I typically work till 5 to 5:30. And then in Hill City, I'm on call every third night, every third weekend. So every third night I could get called back to the ER, or on the weekends, I would work in the weekends. So it's a lot of variability here. Then every once in a while I come to the high school and talk. Next one. Similar jobs, we already talked about some of these. You could be a nurse practitioner or a physician's assistant. Those are both great jobs. They don't have as much schooling, but they often do a lot of the same jobs. They will see people in the nursing home and the ER and the clinic. They have a lot of the same job that I do. They don't have the responsibility that I do, and a lot of them have to work under a physician's supervision. Some of the nurse practitioners can actually work pretty independently, but typically there's going to be a physician to supervise. Their physician's assistants and nurse practitioners are not the same. They function the same a lot of times, but don't ever say they're the same. They might get mad. Very similar jobs, varying levels of supervision and responsibilities. Physical therapy, I said that was a close second to mine. You typically do your undergraduate work, and then you do 3 to 4 years of advanced training in physical therapy. You can get a doctorate degree, you can get a DPT, a doctor in physical therapy, and be a physical therapist. Registered nurse, Nikki will talk about that. Typically 2 to 4 years of schooling. Great job, work in the hospital, do a lot of the same things. We do see the same people right there with us. Radiology technician or a radiologist, if you want to do x-rays and CT scans, you can do that. Healthcare administration. If you want to be involved in healthcare, if you want to help make the lives of people better, but you cannot handle the blood or the guts, or you can't talk to grandma about pooping, then get a degree in healthcare administration. Get a master's degree in health, or just get a business degree and work in a hospital. Become an administrator, work with insurance companies. A lot of different jobs you can do, and not just take care of people in the healthcare world. Or you do research. Not for me, but you can, if you want to do research and mess with rats in the lab, you can do that too. Next slide. Anybody have any questions?
I did. 1 second, I gotta find it. You might remind me after unmute. Cindy's talking.
I know one of the questions that some of the kids may eventually have is, if you do become a physician, are there student loan forgivenesses if you go out into the rural areas?
Absolutely, and that's actually a very good point. I was going to talk about that. I did say there's payment plans, but specifically in Kansas, there's a program called the Kansas Medical Student Loan Program. It's only for medical school or medical students at KU, but it will typically pay all of your tuition, which at KU, in-state's about $25,000 a year. Out of state's about $47,000 a year. It'll pay all your tuition, and it'll actually give you about $2,000 a month to live off of. And then if you work in an underserved community in Kansas, it'll take care of all your student loans. So that's In my case, that $308,000 of student loans that I have, if I work here for another 3 years, it'll all be paid for. Now that's not for surgeons or cardiologists, dermatologists, or anything like that. That is only for primary care physicians, which is family physicians, pediatricians, emergency medicine doctors actually count on that too. So it does not work for everybody, and it doesn't count if you want to work in Wichita or Lawrence or Kansas City, but it can be anywhere else. If you want to work in Manhattan or Junction City or Hayes or Russell, all the Dodge City, Garden City, all those cities count as underserved in Kansas. But it's a very, very good loan program. And there's other ones. Nurses have different programs for student loan repayment. And if you want to do other jobs, there's plenty of opportunities.
No, you have to go through Kate.
That's basically my question.
Somebody would say, go ahead and repeat that, please.
How do you qualify for the loan?
During your first year of medical school, you would apply for it. You can apply for it before, but oftentimes you actually have to get into medical school and then apply for it. And in the past, it's been very easy to get. Lately, it's actually a lot harder to get. But if you are dedicated and want to come back out to a very small town, you're almost guaranteed to get that, or to get the program.
Do you ever get a
Yes.
Do you ever get a patient that is like near death?
All the time. Yeah, we've had car accidents, we've had gunshots, we've had heart attacks, pneumonia, really bad pneumonia, strokes, seizures. We probably fly somebody out every month, every 2 weeks sometimes twice a day. That if somebody comes in really sick, it's our job to do everything we can with the help of my wonderful nurses to get them stabilized, and we'll put them on a helicopter. Just a few weeks ago, we had a younger guy that was very, very sick, and we actually put him on an airplane and flew him out of here. So yeah, if it happens in Graham County, and typically it's coming to our ER. I may not keep him very long, but if it's happening in Graham County, it's going to come to the ER.
Wow.
Let's go.
That's why they make us go to school a really long time.
What kind of advice do you have for getting into medical school? Besides the basics,
Make sure it's what you want to do.
Mm-hmm.
Make sure it's what you want to do. If you have commitment, you'll be fine. If you have the drive to do what it takes, you'll be fine. You don't have to be the smartest person in the world to get into medical school. You have to be committed. It's a long journey. You have to stick with it. But getting good grades is important. Getting involved is important. Joining the pre-med group or the biology club or the microbiology club, whatever organizations, get in with a physician and come see what the job's about. That's probably the first thing, is to see if it's what you want to do. Come work in the hospital with a doctor. Shadow us. See what we do on a regular basis. See if it's what you want to do. And then when you're in undergrad, get good grades and study hard. I didn't talk about the medical college admissions test, the MCAT. It's kind of like the ACT except on steroids. It's an 8-hour test you have to take, and then your score goes toward your application to medical school. To get into medical school, last year they had 48,000 applicants. So 48,000 people applied to medical school. 20,000 people got into medical school. So that's actually just a little less than half of the people that apply get in. Now that's all medical schools all over the country. To get into KU, which is where I went, they had 2,500 applicants, and they accepted a class of 180 to 190. So at KU, it's about a 1 in 10 chance of getting in. So it's a little harder to get into some of the different medical schools, but if you want to do it, just keep applying. I got denied the first time because my application wasn't good enough. I'll be the first to admit. But I got in the second time.
Okay, if anybody has any additional questions, they can either text Jackie. We'll give you the information here in just a little bit, but my number is 567-3222, or we have something we can throw up on the slide with my email address as well. So thank you very much, Dr. David.
Thank you, everybody.
Okay, our next speaker is Nikki Presley. She is a registered nurse here at Graham County Hospital, and we are very excited to have her. She's been here at Graham County for about 18 years, and she comes from La Crosse. So I'm going to turn it over to Nikki. We're going to pull up her presentation, which I think is already there.
Can I ask there at Hill City if you will move your camera over a little more so that more of the presenter can be seen? Because as they turn to look at the stuff, we lose them. You're good there, but if you move to look at the projector, sometimes we lose you. So we move that on the pan tilt. Move it to one side a little bit more so we can see more of the presenter.
Cindy, we're just not sure how to.
I can just kind of stand over here if you want me to. That way.
Okay, well, I was going to say, just make sure you don't back off and out of the way.
Can I do this?
So we lose it.
Okay.
Yeah.
All right. Well, I am Nikki Presley, and Dr. Atkins ran into my time, which is usual because doctors really run into nurses' time, and we're used to that. So anyway, I have been here 18 years. I started out as a CNA, which is a certified nursing assistant, which they do the work, and we kind of help them out. So nursing assistants are very important, and I say if you're going to get into nursing, that's a good place to start. Get your CNA, start working with people so you know if that's something you want to do. I earned my LPN. I went to school for a year, got my LPN, which is licensed practical nurse, and then I went on to get IV certified. When you're a licensed practical nurse, you can still do nursing work, only there's specific things that you can't do. Being IV certified, you get to do IVs. Yay! You get to put needles in people. And so you can do that additionally with your LPN. So I did that, and then I went back to school for another additional year and got my RN, which is the registered nurse. And then you can do anything. You can also go back to school, like he said, 2 to 4 years. So you can go and get a bachelor's degree. There's nothing different about a bachelor's degree than an associate's degree, which is associate's degree is what I have. There's nothing different that you can do in a hospital having your bachelor's degree as a nurse. You can, most bachelor degree and above that, master's, doctorate, things like that. You can do more paperwork, work in an office, more administrative type of things. So, that is an option. I always worked while I was in school. I think it's very important. Yeah, go ahead and go through. I always worked while I was in school. I think it helps. I think you get some knowledge as to is this something I want to do, or oh hey, I don't want to do this. It's too hard, or I just can't handle it. So I always encourage people, if you can get a little bit of experience and work with people. I also even had my EMT, which kind of got me started as well. So that is an option as well. Next slide. Okay, we're good. There is lots of specialized nursing, just like the doctors. We can do all different kinds of things. You can do obstetrics. If you want to deliver babies, you can. And I encourage you to do that. That's not something that we do here, except for, like he said, in an emergency situation. But if that's what you love, if that's what you, and I've done it before, and I do have to say, and it's an amazing process, and I love to see it. Is it something I want to do every day? No, it's not what I enjoy doing. But if that's something you want to do, great. Geriatrics, working with the elderly. As he talked about, yes, Grandma does like to talk about her pooping, and that's part of it, but so does everybody else. And geriatrics is a wonderful specialty to get into. Nothing is better. They don't only talk about pooping. They talk about how they were when they were younger, and working with the elderly is amazing. You learn so much. You learn about their life, and I enjoy that. And so that is a specialty. ER, this is my forte. I love ER. And if anybody who knows me knows I love to go back to the ER. I love everything about it. I love the trauma. I love the broken toes. I love the blood, the guts, the gore. That's me. That's my specialty, if you want to call it. So working in a small hospital is great for me because I get to go and do all of that. I actually, right now, I am working in the pharmacy, and that's kind of I'm the pharmacy director. So I run everything in the pharmacy. I make sure that the hospital has drugs. basically. But in that, being in a small hospital, I get to go everywhere and I get to do everything. So if they need me in the ER, I go to the ER. If they need me in the outpatient room, I go to the outpatient room. I kind of just go everywhere. OR, operating room is a great place to be. You do surgeries most of the day. You do procedures. Our operating room team, we don't have a lot of surgeries like we used to. Well, our surgeon left, so we used to do a lot of surgeries, a lot of appendectomies, taking your appendix out, taking your gallbladder out, taking your tonsils out, which we used to do all that, but we don't do that anymore because our surgeon left. So now we transfer everything to Hayes. Cardiac nurse, cardiac team, you can do that. IV teams, there are some nurses that's all they do all day. They do IVs. And so if someone usually in the bigger hospitals, you have an IV team. So if somebody needs an IV, then they call the IV team and they go put the IVs in. So that is an option as well. You can do forensic nursing. You can do legal nursing. You can do hospice nursing. You can go in the military and be a nurse. You can do diabetic nurse. I mean, there is a gamut of things, just like being a physician, that if you want to choose from, it's not all about just working in a hospital. So there's a lot of different options out there. Some benefits. There we go. Benefits of working in a community hospital. We're right here. If we didn't have our hospital, most people would have to drive 30 minutes to an hour to get to a hospital. So I love being in our little small hospital, and it's right here and available to everybody. I am always learning new stuff. Every single day I learn something new. If it's a new medication or, from a doctor from a different town calls and needs something done. A lot of times we can do that. So I'm always learning something new. All nurses have to be knowledgeable about every single part of nursing. Like we talked about, you can be in the ER delivering a baby, or you can work with a 3-day-old, a week-old, elderly people with special needs. I mean, we have to know how to do it all. The huge thing about working in a small hospital, we generally know all of our patients. We generally know all of our patients, all of their history, what they're allergic to, what their medications are, and that's huge for me. There's nothing better than being able to be one-on-one with a patient and, when they come in, be like, I know you're allergic to this and I know you take this medication. It's comforting for them and it's comforting for us because they know who we are. So I can't tell you how many people are like, oh, Nikki, I know Nikki, or just like everybody who works there. They know who we are, and they get upset if we're not there. So we all, as a staff, we all work together. I mean, it's not X-ray, it's not, surgery. It's, we're a staff. We all work together to give great patient care. That's what we do, and I think we do it well.
Good morning. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Lunch today is chili.
Alrighty then. Hello. Probably Hill City because they're all the ones with their mics on.
Hello.
She muted it while they're going through.
Okay, we've lost your audio at Hill City.
Sorry about that. Nursing is the fastest growing occupation in the United States. So, if that's something you're interested in, it's definitely getting bigger, and RNs comprise the largest single component of the hospital staff, which is so true. If you look at Graham County Hospital staff, RNs make up, not RNs, nursing makes up the biggest whole. I mean, because nobody else has as many staff as what we do. Nursing is a medicine and a discipline all to itself. We're not just there to take care of the doctors. We're not just there to let the doctors boss us around. We actually have nursing diagnosis, and you will learn those if you go to nursing school because you do those a lot. And, if somebody needs a monitor put on, we do that because that's part of our job. So our mean hourly wage is $33 an hour. I'm not saying that's what I make. I'm saying that's what the mean hourly wage is. And about $68,000 a year. So that's all depending on where you go, what your specialty is, whatever you want to do. I will tell you that you can travel. Travel nursing pays very, very well. I've heard they pay up to $50 an hour, and that is you go wherever they want you. So if somebody is low staffed in this hospital, then they call you and say, hey, we need an RN to go here. So, and then you go there and work for them your 8 hours or 12 hours or whatever. According to the 2014 Gallup poll, nursing was rated the highest ethical and honest profession. Yay! I'm proud to hear that because we feel like we are very honest and ethical. We are the patient advocates. So we're there when patients are scared, confused, lost. Your nurse is there. I'm sure each one of you has had an experience with a nurse, and hopefully it was a good one. But you will know that most of the time you can come to your nurse and talk to them. So we get the opportunity to talk to people and be there for them. So we have a very flexible schedule most of the time. It depends on what specialty you want to go to, whether you want to work 8 to 5. That's what I do right now. But don't worry, I put in my time. I started out on night shift, then I slowly worked up to day shift, and now I get the 8 to 5 job. Lucky me, but you can kind of pick where you want to be. So, next slide. What do you think of when you think of a nurse? Florence Nightingale, everybody. I don't know if you've heard of her, but if you go to nursing school, you will. Lady with the lamp. She was the one. She is the founder of nursing, and she's our role model. Next slide. This is how nursing has been throughout the years. Everybody, most time when you think of a nurse, you think of us in our little white uniforms and our little white caps. And a lot of times they wore dresses or skirts. And when I first started in the hospital, we did have a gal who used to wear her dress and sometimes a hat. And it was kind of neat because, let's just face it, that's kind of fun. So yeah, as you can see, the 20s, 30s, and going through the years, and you see those comfortable shoes there in the middle. Don't you want to work in those all day? No, thank you. After 12-hour shifts, my feet would be killing me. So God bless those old nurses because they were really tough. In the 70s, yay, there was pants. So nurses got to start wearing pants instead of those dresses because I don't know how they worked in a dress all day. But so that was and now 2015, here we are, and we're, as you can see, we're in scrubs. So, and we don't wear hats anymore because everything carries bacteria now, and so I'm lucky we even can get dressed. So, how many of you think when you see a man in a lab coat, you think, well, he must be a doctor because he's wearing a lab coat? Well, that's not true, and men play a huge part in nursing. And right now, statistically, there aren't a whole lot of men in nursing, and that's why I encourage men to go into nursing because it's very, very fulfilling. Only 9% of males are nurses. And I have a little video here, if it'll come up. It's just a little 2-minute video. Everyone can hear it.
My name is Justin Combs, and I'm a nursing student at Northern Kentucky University. Ever since I was little, I can always remember wanting to be a registered nurse with the nurses that I've seen in my family.
What got me started was I'm in the Civil Air Patrol, and I was a medic, and I got the opportunity to go and become a field medic with the Civil Air Patrol.
I thought about med school and realized that I just wanted to have that more hands-on contact and really work with people.
I really didn't know that I wanted to do nursing until late in high school, and after doing some research into what nursing was, I realized that it was the perfect decision.
What really made me choose nursing is when I really thought about the career and what it embodied. If you would have told me I was going to be going into nursing, 5-10 years ago, I would have, probably looked at you like you're crazy.
I've always really wanted to help people make a difference and have a purpose in life. And that's what nursing is for me. Nursing is something that gives me a reason to work, and the harder I work, the more where it'll help people.
I think what really sparked my interest into pursuing a career in healthcare was when my father became ill, and I did some caretaking after he was discharged from his long-term care facility. That's when I realized I had the compassion to, care for another person who's in a time of need.
I went to one of the nursing sessions at UAB, and during that session, I'll never forget it, one of the professors was in the middle of speech, and she spoke this one phrase, and what she said was nursing is the one profession that you can take hold somebody as they take their first life breath, and then you can also hold somebody's hand as they take their last breath from life. After that, I just knew that's what I wanted to do.
The nurse combines not only the technical skills that you need in healthcare because you're dealing with someone's life, but it also incorporates an understanding of them on an emotional and spiritual level as well.
Nursing, building relationships, friendships with other people, and it's just a rewarding field to go into.
We're excited for our careers as nurses and wherever it may take us.
Nursing is a very exciting career, and I recommend it to all you guys out there. Men can be nurses too.
Okay, that's right. Men can be nurses too. So we are lucky enough to have 3 nurses on staff that are men. I will tell you that they're, just as women, women patients like to have women nurses. Some men like to have male nurses. So I encourage all you guys out there to look at that, because just because you think man, doctor, that's not always true. Nursing is so fulfilling. It is. I can't talk about it enough. When he talked about holding a patient when they take their first breath, I've done that, and holding a patient when they've taken their last breath, I've done that, and I can't tell you how fulfilling that is. To know that you've been there and you've touched that patient, you've taken care of that patient, you've held that patient, and not only that, but their family. It's huge. Okay, schooling options. Like I said, 1 year you can get your LPN, 2 years your RN, 3 years they don't really have. There's less than 10% of these now. The older nurses you saw were diploma nurses, and they did 3 years of basically in hospital learning, and but they don't have any of those anymore. 4 years you can get your bachelorette, and then you can go up from there. Nurse practitioners have their master's degree, and when he was talking about nurse practitioners, PAs only go to school, I believe, 2 or 3 years, where a nurse practitioner generally they've got their RN and then they've gone on to school and gotten their nurse practitioner. So. And then, of course, your doctorate, you can go for that. There is financial aid available. One of them is the State Board of Regents, and that is offered here. What you do is you sign up for it, and the hospital helps pay for your schooling, and then you just have to say that you will work at our hospital for so long. And that can be bought out to say, like, if you have to move and you've signed with Graham County Hospital and said, I'll work there for so long, and then something happens and you have to move and go to another hospital, if they are also a part of that, they can buy out your scholarship. So that is an option as well. And there's lots of financial aid out there. So Florence Nightingale, live life when you have it. Life is a splendid gift. There is nothing small about it. Isn't that the truth? I can't tell you how fulfilling nursing is and how much I appreciate it and how much I like it. And does anybody have any questions? Well, I made up questions because I knew you guys were going to ask it. So, okay, so do I love my job? I love my job. I can't imagine doing anything different.
Your conference is scheduled to end in 2 minutes.
So I enjoy going to work every day, which a lot of people can't say that they enjoy going to work. I love going to work because I get to do something different. I have taken care of friends and family, which is hard. I've put an IV in my own son before. When they need it, you have to do it, so you just do it. And I've put IVs in friends and my dad and anybody else who needs it. The best thing I've ever seen is I've seen a baby born, of course, and I've also seen someone who was clinically dead come back. That's cooler than anything I can ever imagine. So, worst thing I've ever seen is I had a very close friend who was very, very sick and stopped breathing on me, in front of me. In probably 18 years of working in nursing, that's probably the worst thing I've ever seen. And she did fine, but it was probably the worst thing I'd ever seen. And my favorite place to work in the hospital is ER. I've told you that. He was talking about flying people out. I will have to say, at one point, you never know what's coming in our hospital. Never, ever, ever. And at one point, we had 4 airplanes here at Graham County. We had a car accident, and at one time, my husband has pictures of, we had 4 airplanes because we were flying 4 people out at one time. And it was all hands on deck, and we had everybody here. So, and everybody made it, and I'm pretty proud to say that we got him through and got him out of here, and they all did fine. So, anyway, why did I become a nurse? I became a nurse because, actually, I became an RN after I became an LPN. LPN was very fulfilling.
Your conference is now over. Goodbye.
I became an RN because I wanted to give medicine, pain medicine. When you're an RN, you can't give certain